Good afternoon, everyone. This is our afternoon briefing today. I've got to lead off by saying that we have had our second death in West Virginia. I hate that like crazy, and I'd sure solicit all your thoughts and prayers for the individual and the families. I promise you that all those in the healthcare community and all of us are trying every way within us to minimize our deaths and to minimize and help those that are experiencing sickness. I touched on this yesterday. I'm not sure that I did this in the briefing, but I would like to just say just this, and that is, if you'll watch what's going on, from the standpoint of just within our country, we're losing an equivalent of the number of people that we would on a relatively large airliner about every 2 or 3 hours now. And if we had a commercial airliner go down in this country, it would be the number one thing across the news. So don't stop thinking the magnitude of the seriousness of this situation. Now, West Virginia, even to today, is still trending the right way. From the standpoint of an average, we're still trending right around that 4% level. Yesterday, we popped up just for a day, and it could just have been a blip on the screen and everything, to about 6.7%. Now, I don't have all the numbers yet and everything to be able to report to you today, but I would just caution everyone to just stay the course, keep doing the good work. You've heard the hygiene stuff over and over, but I tell you again, wash your hands. Keep your hands away from your face. Keep the social distancing going on. Absolutely, I commend all of our businesses and I thank them over and over. And from the economic standpoint, just use us, use yourself, use every capability of every website to be able to look up all of the ways that the federal stimulus package is impacting you and your life and our businesses and our state in general. Any questions you may have and everything, just shoot those questions right to us or call, and we'll get back to you. We're posting stuff nonstop, and just stay on top of that, because the economic impact of this will be okay. We just got to look after our people and get through this from a health standpoint. A couple other announcements. I just said, oh goodness, what am I going to end up announcing next? But I don't say this lightly, but when I look down here at my notes and it says, the West Virginia Rural Water Association wants me to remind all West Virginians to do not flush disinfecting wipes down the toilet, because it's causing us all kinds of problems with your wastewater treatment facilities and everything. So again, just take heed to what our experts are saying. And the only other thing that I have right here is there's a group called the Countrymen Communications. They're actually located in Greenbrier County, and they're assisting employees with access to high-speed internet. Countrymen Communications, a West Virginia small business based in Greenbrier County, has offered to set up free Wi-Fi access points for people to use. Now, right now, they're setting these up in parking lots, and they're setting up at the West Virginia State Fairground, the Alumni Park in Alderson, and in Williamsburg at the Volunteer Fire Department. And I want to again send out a special thanks to Carrie Scott, who runs the Countryman, and she hopes to be able to expand this to more sites in the very near future. But other than that, that's about all I've got today. And again, please just keep your thoughts and prayers for the individual we lost and all their loved ones. But I thank you.
Thank you, Governor. Ladies and gentlemen, as part of our briefing today, our friends with the media are once again joining us by teleconference, and we'll be taking their questions in just a moment. But first, we're going to take comments from some of our panel members. Up first, West Virginia Superintendent of Schools, Clayton Birch.
Good afternoon. I just want to give a brief update on a few items from the Department of Education. Yesterday, the governor announced that we would be extending the school closure through April 30th. Those of us in the education field, from principals and superintendents to teachers to service personnel, we don't take that lightly. In fact, we have risen to the challenge. I can't thank our teachers and service personnel enough for stepping up and supporting our families and our children, and the stories that we're hearing from families that need these meals and rely on our school system to be that connection and the caring adult that we need is very, very important. I was disheartened to learn today of a letter sent to the governor on the closing of school. The governor and I spend a lot of time each day discussing children, families, and teachers, and it is quite disheartening that we would have a divided message on the closure of schools. The choice to extend the closure through April 30th was not made lightly, wasn't made lightly at all. In consultation with the health department and what we thought was best, being optimistic for our families and our children, we want a single message out in the field, and I think it's important that folks understand that that message needs to be a single message. We want to be as optimistic with our children and our families as we can. It's really important that our young children know that there's an end and there's a people that care and know that we're going to get through this and it's going to be okay. And we want it to be very optimistic that if it is, we want you to be able to come back to school. We want to save that time at the end that if you can see your friends and you can see your teacher, bring some closure to the school year, we want to take advantage of that. And we know we've got a big job in front of us too when it comes to summer learning. And we're going to need that time to prepare. And we're going to take advantage of any time that we can get. 42 states in the nation have not thrown in the towel. They're being optimistic, as our governor is. And I think our teachers and our service personnel, they've stepped in behind him. They're doing a remarkable job with remote learning. As a matter of fact, I want to announce, too, we have a partnership, and I think it's really important for folks to see and what our teachers are capable of. We have a partnership with public broadcasting. Every Tuesday and Thursday at 9 p.m., you can tune in. And the partnership is highlighting teachers in the field. They're actually demonstrating these lessons and what you can do at home with your children as several pieces of content. But more importantly, beginning next week, we're going to expand that. We're going to be looking at additional days. We're going to be looking at additional time. And we're actually going to be putting in some guidance and programming for parents, too. This is really hard on all of us, but just God bless those out in the field, the teachers and the service workers that are making this happen, and I'm just so proud that we have a governor that's being optimistic, and I think it's really important for our children. Thank you.
Thank you, Superintendent. Up next, West Virginia Attorney General Patrick Morrissey.
Well, thank you very much, Governor, for the opportunity to be here, and I'd like to just take a moment and echo some of the comments of the Governor and also just update citizens on what's going on some of the important consumer issues. I think we all know that there's a Herculean effort going on right now with the truck drivers, with those who are supplying our grocery stores. People are working around the clock to restock the shelves, to make sure that food and urgent supplies are available for you. These people are doing everything imaginable to help West Virginia, and everything we've heard is that the supply is getting restocked on a periodic level. So just kudos to all the amazing West Virginia workers out there. You're really showing your true mettle during this really tough circumstance. Wanted to update people on the price gouging consumer side. We know that we're now over 300 complaints coming in. We're getting a lot of questions about landlord-tenant and also about cost of eggs and chicken and beef. We're going to investigate every single instance and allegation of price gouging, and we're going to enforce it. But on a broad enforcement matter, I would just ask people to think about acting reasonably. Most people are trying to do the right thing during these tough times. Just if people can slow down a little bit and make sure you practice the social distancing and a lot of the measures that the governor's talking about, we're all going to be much better off. So I'm pleased to be here today. and our office will field any questions that come up. We're trying to work collaboratively with the governor and other state agencies to provide as much information as possible during this difficult time.
Thank you. Up next, Dr. Clay Marsh, our coronavirus czar.
Well, it's great to be with everybody today, and I am very happy to report that we continue to do the work as a community, as a state, that is helping some of these prediction models that we talked about yesterday, like the one at the University of Washington, show progress in their prediction for the state of West Virginia, in that the projection is we'll need less ICU beds today than we did yesterday, and that fewer people are predicted to die from this COVID-19 pandemic than was yesterday. And as we talked about, although following these trends can be very useful as a guide for us, that the future will be written by what we keep doing, not what we've done to date. Now, there's a couple of things that have come up today that I think are important for our citizens to know. So number one is the mayor of Los Angeles issued a advisory that wearing masks for the citizens of Los Angeles was potentially beneficial. I know that Dr. Tony Fauci, who has emerged as an expert or the expert in the country, is also struggling with this. And so let's talk just for a second about the utility and the benefit of wearing masks or not. So first of all, the finding that is now starting to get people interested in wearing masks is the idea that not only with coughing, but perhaps with speaking and even throat clearing, there can be a small amount of droplets that are produced that might be infectious. So the most important strategy that we all have been following, and I think people in the state have been doing a great job of, has been what we have called social distancing. And the reason why we've asked people to be 6 feet apart is not just because we are just choosing a number on a dartboard, but it's because that is a distance that is felt to be safe to avoid that type of droplet dispersion that can happen from talking, from clearing your throat. And so the most important thing that you can do to maintain your health and your family's health and community's health, and as we've talked about our healthcare worker and first responders' health, is to maintain good social distance. Now, people have written, emailed, texted, been on Twitter and said that not everybody's doing that when they go to stores, they see people very close together, that they still see some people in a place meeting or even worshiping, which of course we want to highly encourage worship, but not shoulder to shoulder, not person to person. Because again, our power and the reason why some of these statistical models are changing is because we're doing all the right things. We're staying in our house. We're staying socially distanced. As the governor pointed out, we're not touching our faces. We're washing our hands. We're being thoughtful and careful. And again, we're being thoughtful and careful to avoid being ill ourselves. But importantly, we're doing this for all of our health, because when this virus starts to move in its more compounding or logarithmic phase, where person-to-person spread is starting to go faster and faster, then it gets really, really hard for us to keep up with things. And we are very much concerned about the people that are caring for us, about, our healthcare workers we've talked about the people that are, maintaining clean facilities in these places, for the people that are working at desks, for the first responders, for our EMTs, police officers, firefighters, many other people stocking our grocery shelves, that we want to make sure that we're providing a safe environment. And so if you want to wear something over your face, and the benefit of wearing something over your face is less for you to protect yourself from getting sick, and it's to reduce the droplet spread in case somebody's sick and doesn't realize it yet. And an interesting finding is that some people have lost their sense of smell. So if your sense of smell immediately leaves you, then think maybe I do have the viral infection, because that is something that's been found. But using a face covering is really more important so that you, if you're infected, don't create those droplets to infect other people. And if you wear a scarf or if you wear a bandana, it does the same benefit. But I ask you to not, to take care of yourself and to do what you feel safe. Stay socially distanced. And if you wear something over your face, don't buy a medical grade mask because we want that for our first responders. I am really moved by the community, and we've heard this in all sorts of different ways, shapes, and forms, people helping each other. West Virginians starting to make masks to help our first responders, to help our medical people. And that is really what makes this state so great. And we know by all the models that if we voluntarily follow exactly what the governor has asked us to do, then we're going to keep increasing and benefiting the people, reducing the deaths, reducing the need for critical care beds, and we can be the beacon for the rest of the country, but only if we keep it up. So thank you, West Virginia, and that's my report.
Thank you, Dr. Marsh. Up next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As the governor and our team continue to stress, doubling down on the things we're doing are exceptionally important, but also we're looking at a lot of innovative ways to continue to reduce the spread of the virus and protect our frontline workers. I'd like to show a video before I finish with a couple of items of an innovative approach we're using to help that process to stop the spread, but also help protect our frontline retail workers. So if you would, please roll the video. So I apologize for the lack of sound. I'll just give you a little overview and then we'll make that available on the National Guard website. That was our National Guard personnel working with folks at Walmart, training their associates in how to use the proper PPE with gloves, as well as hand washing techniques and other techniques that can be used to help reduce the spread of the virus. There's also out on the National Guard, West Virginia National Guard YouTube channel, videos of how we work with other organizations to decontaminate boxes and products coming into stores, again, to help reduce the spread of the virus and protect our frontline retail workers. I would like to tell you today that 420 National Guard personnel are on duty. In the last 24 hours in the stabilization efforts, we've helped pack at Gasaway over 1,500 emergency food boxes for family, as well as over 430 boxes in Huntington. In addition, critical supplies from the national stockpile went out yesterday to all 55 counties in the state of West Virginia. In the last 24 hours also, National Guard personnel working with their partners and counterparts at epidemiology at West Virginia DHHR have conducted over 430 contacts in the contact tracing engagement piece. And a couple of last items, we've provided or are in the process of providing 275 gallons of hand sanitizer to the Bureau of Senior Services to help those folks that they serve on a daily basis. Again, I would ask on behalf of the members of the Guard, all of our first responders and law enforcement folks, healthcare workers out on the front line, please listen to what the governor and the team are telling you. Double down and we can continue to break this curve and be a national model, as Dr. Marsh states. Thank you.
Thank you, General Hoyer. Up next, we'll go to the West Virginia DHHR with Secretary Bill Crouch and our State Health Officer, Dr. Kathy Slim.
Good afternoon. During this time when we have less face-to-face contact with folks out in the communities that can provide assistance to you, I want to make sure everyone is aware that you can obtain services through our website, and that is www.wvpath.org. Virtually all of the services that DHHR provides are available through that online website. You can also find in each community an organization called Family Resource Network. That organization can help you get in contact with other providers that you may need or other services that you may need. That website is www.wvfrn.org. That is the Family Resource Network at www.wvfrn.org. I want to also mention that April is Child Abuse Prevention Month. Under normal circumstances, many of the cases of abuse and neglect are reported by teachers, child care providers, and caregivers. During this period of social distancing and Governor Justice's stay-at-home order, it's vital that neighbors and families continue to look out for each other and report any suspected abuse or neglect that they see for our children and vulnerable adults. That number is, let me give you that one more time, 1-800-352-6513. As the governor said, everyone is doing a terrific job in West Virginia in terms of social distancing and keeping our curve flattened here. But we are expecting more cases, and with more cases, we will have more hospitalizations. Please understand our medical community is doing a terrific job, working extremely hard to be prepared for this. Our healthcare workforce is doing an unbelievable job under difficult circumstances. We thank them for what they are doing. We are moving forward on backup plans with other hospitals and long-term care facilities. We'll keep you updated with our progress on that. So let's be cautious, use good hygiene, follow the governor's orders, and stay at home if you can. Everyone be safe. Thank you.
So I would actually like to echo those, but I'm going to move into another topic as we speak about education and learning and support of each other through this event. And so first, thank you to our healthcare workers, our first responders, all the folks behind the scenes that are doing incredible work to address this issue across communities and with communities. I want to highlight a really interesting and novel thing that has evolved here and to share it with you. We have been graced over the last few weeks to have Dr. Lisa Costello from WVU, a pediatrician, working with us. And her work here has inspired an idea that is now actually launching across West Virginia and being picked up by other states as well. So she got this idea and has worked with a group of medical and education experts at WVU to help parents and children take the advice of Mr. Fred Rogers and to, quote, look for the helpers during the COVID-19 pandemic. So the program is actually called #Let'sGoGratitude. It stands for Leveraging Education to Show Gratitude of Occupations. Let's go. And what it does is it works to educate youth about a number of careers essential to combating the virus, from epidemiologists to health officers to food service workers to custodians to healthcare workers. And so it really is a creative piece. It's got a curriculum around it, starting with younger children and then increases to include older ages over time. It really is, in addition to that educational piece, is aimed at sharing gratitude for the essential workers that the kids learn about. So as students learn about each field, they are asked to create a sign or a card, to snap a photo or write a letter to share with workers in that profession. So it really is a fascinating and fun initiative. It is evolving, it's getting picked up across the state. We've actually now had inquiries from other states, and we're working with Florida to begin to implement it there as well. So it's another opportunity to connect in different ways, to use this as a learning opportunity, and to help our children understand and deal with an evolving and challenging time. So I just wanted to highlight that piece and say thanks to Lisa and all the partners that are working on that.
Thank you both. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. To media members, when we call on you, please remember to unmute the microphone on your end before asking your question. The first questioner today will be Keith Connor with WDTV. All right, it looks like we may have lost Keith. We're going to go to Taylor Stuck now with the Herald-Dispatch.
Hi, yeah, it's Taylor with the Herald-Dispatch. I have been hearing from people that the private labs doing testing are having a long turnaround time. In some cases, it's almost 2 weeks, which is, the quarantine period. I was wondering if the governor was considering maybe
really get the end of the question, but I think, Clay, you can answer this better than anybody, and Dr. Marsh knows, that there are labs that are out there, that it takes almost 7 days or maybe in excess of 7 days to get results back. Every single day that goes by, we're getting more and more and more labs and more potential to process stuff faster, but Clay, you could jump in and probably give a better answer than I.
Well, thank you, Governor. And I, exactly what you said, that we are working with a lot of different solutions because the need for testing is so great, and many private laboratories have come into this to try to meet this almost insatiable demand that we have right now. And I'm going to give a lot of kudos to Commissioner Slimp, who is really spearheading this on the state's perspective. The private vendors have gotten behind, and they've opened up new channels, new places, so they are committed to making this faster. But the more we can become self-sufficient as a state, and like our medical schools or at Marshall and at West Virginia University and at CAMC, and I believe CAMC might be doing the most samples per day now of all of our state's entities, besides the focus work at the Department of Health and Human Resources. The more we can ramp up that testing, the better off. And based on having the federal commitment to giving every state additional testing, we have recently gotten the rapid test that will be very useful for us when we are investigating problems in the field or when we need an urgent answer. And I don't want to take this out too long, but really Dr. Slimp is the expert, and so if people have questions, certainly directing them toward her will be good. Thank you.
Anything to add to that, please do.
Simply to say that we are actively working in that. It is such a critical arena. The primary issue has been limited supplies, as you know. We are advocating actively for those and working to identify those, partnered with the Guard and others, and congressional delegations and leaders here, the governor, et cetera, to maximize as much as we can to obtain some of these supplies for West Virginia. So we are exploring both and operationalizing both some expanded capacity and technology in the state lab to do some of that testing at a clinical diagnostic lab system as well, trying to get hospitals availability up and running, and then more fully. And then finally, again, with the rapid testing, we'd love to expand that more fully. We've gotten we hear there's some early components coming to here, but the big issue there is getting enough tests and cartridges that will actually allow us to use that widely to ramp it up. So there's lots of work underway in that arena. One we really think is critical, and we've got tons of people thinking about it and trying to get it mobilized. So we appreciate especially the Guard and WU's and others' support and help in doing that.
Okay, thank you, Taylor. Up next, we'll go to Kara Lofton with West Virginia Public Broadcasting.
Kara Lofton here with West Virginia Public Broadcasting. So hospitals, we saw that Williamson Memorial Hospital closed, and then that there was some kind of redemption with that. But hospitals in general rely on elective procedures and on some of these things that they're now not doing in order to have the revenue that they need to be functional. And a lot of hospitals in West Virginia are super close to the margins. I mean, we're seeing this with rural hospitals all over Appalachia. You know, coronavirus is actually creating this situation where a lot of hospitals are actually slower while they wait for the surge. And I guess my question is, you know, how long can these hold out without surge?
I think I can take that, at least, you know, start with it. But we're very aware of exactly what you're saying. And we're very aware, you know, how critical it is to try to maintain our community hospitals. And we know that our community hospitals in at least some ways need their elective, you know, procedures to be able to do them. We get all that and everything. But the issue today is supplies and protective gear for all those that are out there that are going without that. I mean, first responders, you know, all the healthcare community and everything. And so for today, you know, and I'm very hopeful that we're going to be able to lift that as soon as we can possibly lift it. But for today, we have got to conserve those supplies in every way. Now, just stay with me just 1 second. All of us have got to realize one thing, and one thing for absolute certainty. This is a pandemic that nobody has ever seen anything like it before all over the world. And from the standpoint of the U.S. just got caught in a really unusual and uncomfortable position. The U.S. in general, not enough testing kits, not enough antibiotics, not enough protective equipment, all those supplies that really and truly we just got caught as a nation. And now you have everybody in the world screaming for the same thing, especially from the U.S., but primarily even all over the world, that you've got people screaming for protective gear to be able to help keep our healthcare community to be able to take care of the sick. Well, we're screaming too, and we're meeting the needs, but right now, we've got to put our brakes on the elective, you know, elective surgeries or whatever. I've got a real issue with my hip. And I mean, I'm a direct recipient of this not so good rule. You know, I was due to have another injection back in my hip the first day of April and everything. And I was notified, you know, it looks like at least 5 or 6 weeks, and who knows when it'll be. Well, any elective procedure right now, we need the equipment and we need the supplies, and that's what we're trying to just, you know, make sure that we protect our healthcare community and our first responders.
Okay, thank you, Kara. Well, up next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron from WSAZ. My question is probably for Dr. Marsh. I know we can't live and breathe and predict everything from the numbers, from the health data from the University of Washington. And I know that the need for ICU beds has decreased in the last day, but the data still shows a shortage of 25 ICU beds in the state of West Virginia. Can you talk about that and what's being done to make sure we don't have that shortage when our critical days come, which are expected in about a month?
Thank you, Amanda, for the question. And as I understand it, that prediction model is really looking at the average of use of critical care beds as part of the estimation of the shortfall or the adequate numbers. So we know between all of our acute care hospitals that we can certainly flex people. And we believe if that model is accurate, that we'll easily be able to navigate that. The health system should remain intact. You know, we've talked about the surge, and it's really important that we not overwhelm our hospital capacities. But given the current activities of our citizens and the expectation that as we as a state continue to do all the things that we should do and hold ourselves and each other accountable, that we will be able to weather this storm. And in fact, if we keep doing what we're doing and step it up a notch, as the governor has said, and as some of the other folks on the news briefing have said, then we may be able to bring it to a level that we can do business like we usually do. And then we can release some of the restrictions that we've asked people to do to conserve personal protective equipment and to increase capacity. But right now, we feel that given the projections, that with the work that's being done by Secretary Crouch and the Army Corps of Engineers and the planning for surge, that we should have an adequate number of critical care beds if we do experience what the University of Washington model predicts.
Okay, thank you, Amanda. Up next, we'll go to Jade Burks with WVVA.
Hey, Jade Burks with WVVA. My question is for Governor Justice. In regards to your recent executive order that all individuals traveling from areas with substantial spread of COVID-19 require them to isolate for 14 days upon entry, hotels in our area are wondering what guidance we can offer them if they were to encounter guests from those areas trying to stay in West Virginia.
Okay, I can't understand the question. I mean, did you guys in the healthcare community, did y'all get the question?
Yes, this is Clay.
Okay, Clay, well, maybe you can answer. I can't understand the question. I'm sorry.
So I think the question was if people are experiencing folks from high-risk areas like New York, New Jersey, or Connecticut, and they come into contact with them, and these folks are not self-quarantining for the 14 days, what do the citizens do? Is that right, is the question?
Yeah, mostly I was asking about hotels in West Virginia, what guidance you can offer them.
So
I'm going to do this twofold. Brian, are you? Well, first of all, let me start. Okay. If people are coming into West Virginia to stay, and they're coming into West Virginia and they're planning on not traveling through, then absolutely we expect people that are coming in from New York, New Jersey, Connecticut, Italy, or China to be quarantined for 14 days. Now, we don't want people coming in here from any state. We don't want them coming across, our state borders and everything and coming over in West Virginia because West Virginia is a safe haven, and that's why we closed the campsites and we've done all the actions that we've already done. But from the standpoint of monitoring and what people should do if they're coming in contact, they should contact, I guess, their local authorities. And from that, then their local authorities are going to proceed ahead to talk with these people and to address this situation and to basically demand, if they are planning to stay, demand that they go into a self-quarantine of 14 days. And if they don't do that, then what they're going to basically be doing is stand to the potential of being charged with obstruction. So, Brian, can you, he says he can't add anything to that, so that's basically it.
Okay, thank you. Next, let's go to Anthony Izaguirre with the AP.
Governor, can you speak to concerns that the ban on elective medical procedures is in fact a way to limit access to abortions?
She said something about it, but I couldn't hear him. Anthony, can you repeat it? We couldn't hear you.
I'm sorry. We can't hear you up here. It's just muffled and we can't get it. Clay, did you get it?
No, I just heard maybe something about abortions. That's the last word that I heard. It's very echoey.
Governor, can you speak to concerns that a ban on elective medical procedures was a backdoor way to limit access to abortions?
Well, I think our Attorney General needs to speak on that more than I, but yes, sir. So
what you saw the other day with the prohibition on elective procedures is broad-based, and we can't emphasize this importantly enough. The governor's charged with protecting the public health for the citizens of our state, and he's also trying to limit in-person contact. And so what the governor did is he's trying to say to all facilities that are out there, hospitals, clinics, and others, that you don't have these elective procedures. That is designed to conserve supply, devices, ventilators, and to limit the spread of coronavirus. So there's going to be a reduction in all elective procedures. No one entity is going to be singled out. That'll mean there'll be a reduction in some dental procedures. There'll be a reduction in orthopedic procedures. And yes, there will be a reduction in the procedures within abortion facilities.
Okay, thank you, Anthony. Up next, we'll go to Charles Young with WV News.
General Hoyer, you mentioned shipments from the strategic national stockpile. Yesterday, President Trump came out and said that reserve is nearly depleted. Given that the current modeling shows peak resource use over a month away, what are we doing to, prepare for that and source things on the open market? Could you just address that, please?
Yeah, absolutely. At the beginning of this event, Governor Justice directed us to establish a task force just to look at sourcing from other sources other than the federal government and the national stockpile. We have 6 personnel that work throughout the day to source from a variety of different places across the globe, and we continue to source. And tomorrow we'll provide some more information on some unique things that are being done related to masks and other things that we're looking at. So I want citizens to understand that we are working every possible lead that we get. And folks also need to understand that a lot of times I get a lead that comes in and somebody says, hey, I've got access to 500,000 N95 masks. But as you follow through the process with it, the delivery dates of availability are not until November or December of 2020. So what we're having to do is look at a variety of sources, and then through projection modeling that we're doing for usage rates, try to identify how we can get those in incrementally from a variety of different vendors that may be out there.
Okay, thank you. We have time for one more question. We'll go to Kenny Bass with WCHS.
I have a question for Superintendent Birch and the governor. The letter that you're referring to about school closings, I can only assume is the letter sent by legislative leaders, both the Republican and Democratic sides of the aisle, who urged the closing of schools for the entire year. So I know the governor is doing a good faith effort to try to get kids back into school for at least some period of time. My question is, if it's problematic to have an election on May 12th, where you would have people gathering in places, including schools, what is the reasoning behind the thought that we could possibly get students back into buildings, congregating in large areas, some of those very same buildings that would have had polls in them, and do that safely? If we can't do an election by May 12th, how could we put kids in schools by May 12th?
Well, let me try that, Kenny. First and foremost, everyone's got to understand these decisions they're not easy decisions, and they're tough decisions. And if you don't listen to your experts, then they're irresponsible shots in the dark. Well, I listen to my experts. I listen to the healthcare people. I listen to our superintendent of schools. I listen to the education community. I listen to our parents. I listen to everyone, especially our experts. Now, in regard to the May 12th date, we have to make a decision well in advance, well in advance, to make the right decisions on an extension of the election. What if things, in staying consistent with President Trump and staying consistent with 42 other states that have not issued a closure of schools until the end of the year, what if President Trump, if we decided we weren't going to stay consistent with what President Trump is offering, saying we're going to have basically a stay-at-home situation until the end of April? What about if toward the end of April, things start looking much better. We don't have time at that point in time to extend an election, but we've got to make a decision today on extending an election. We don't have to make an a decision today on terminating school for the balance of the year. There are real values that have been said over and over from our superintendent of schools that he's already addressed today. There are real values to being able to get our kids back in school, if it's even for just 2 or 3 weeks. And absolutely, all the stuff, the good stuff that we have going on every day, the feeding of our kids and everything from learning in lots of ways, today we do not have to make that decision today, but I will absolutely assure you that our superintendent of schools, our attorney general, all of those that are in our medical community are being consulted constantly, and your governor will no way whatsoever send our kids back into a situation that's not totally safe and not totally sound. So with all that being said, I'm going to do the responsible thing. I'm going to listen to our experts. I'm not going to shoot in the dark, and I'm not going to do something that basically denies our kids some level of hope. I mean, our kids are sitting at home right now, very hopeful that they're going to be able to go back to school, and I'm not ready to throw the towel in as of yet.
Okay, Governor, I'll turn it back over to you.
Well, I've just got a couple things just in cleanup, and it just be really simple to just say this, that I thank our superintendent, Clayton Birch. I thank our Attorney General, Patrick Morrissey, for being with me today. I thank all those, that were brought in by video, General Hoyer, our healthcare community, whether it be Secretary Crouch and Kathy Slimp, Dr. Slimp, and Dr. Clay Marsh. All those that are really helping in so many different ways that are out there, I thank you. I absolutely thank you from the bottom of my heart. Our teaching community and everything, and our service personnel are doing incredible work. I just can't say anything more than just this. New York didn't do the right stuff. They didn't do the right stuff on time. Every time you turn on your television, you see another refrigerator truck that's carrying bodies out. Body after body after body. Well, those bodies are those are somebody's loved ones, in every way. And so I just tell you, this is so serious. You're doing the right stuff, West Virginia. I am so proud of everyone out there that's making the right licks at the right time. And our numbers, you'd heard Dr. Marsh, our numbers, and God forbid we don't have a situation like 500 deaths in West Virginia. Yesterday it looked bleaker than it does today, but we've still got to keep our guard up in every way. And the last thing I would tell you is just this. Easter's right around the corner. The time of year that we all worship so sincerely, and such an absolute beautiful time of year. But I would tell you, I've had many requests about people, would like to have, worship service in parking lots where people drove in. Maybe they were in every other, parking place, stayed in their cars, and there was some kind of service given that way. Also, it has been brought to my attention that maybe the broadcasting community would step up to the plate and broadcast Easter services to where people could stay home and still be able to get those services in a really nice way. So I encourage the broadcast community, and I encourage people to do the things like I just mentioned about, coming to a parking lot and worship and everything. It'd just be great. Just don't get out and intermingle together and all that. And again, I can't thank everybody enough, and we're going to stay on top of this, and we're going to do the right thing. We're going to do the prudent thing. We're going to listen to our experts, and we're going to proceed with caution, but we're going to proceed, to do the right thing all the time. So God bless each and every one of you. Thank you.